Today there will be pledges that amount in value to $100 million to improve health and wellness that will help more than 25 million people all across America.
I'm thrilled to announce that the hospital, through the Barbra Streisand Women's Heart Center, is pledging $2 million to launch a national campaign to address issues of awareness, prevention, and advocacy as related to women's heart health.
We will fund a coordinator, a convener, organized by the Clinton Foundation to work to make sure the community is coming together on these issues and focused on these issues.
Our pledge to you is to keep showing up every day. We're going to keep coming up with creative ways to make produce flow like a river.
And as a pledge to the Clinton Health Matters Initiative, and in Brian's memory, I have made a promise. Enough. Enough.
We want people to make healthy changes and to try to reform systems that affect people's health. We need your help to make this a success.
Would you ever have your human genome mapped out and make it public?
I'd be fascinated. Rush Limbaugh and I are probably 25th cousins. You know.
13 years ago, the whole notion of getting your genome sequenced was just, oh my goodness, we had to have the protections in place to actually allow for people to get comfortable. And I think the same thing is going to happen with data.
Patients should have access to everything about them. The book is theirs, not ours.
Do you believe that every state or the nation should have a reporting system both that measures prices and results and that would enable us to dig down and figure out how to improve quality and reduce cost?
We've advocated for that and continue to do so.
Yeah, I think transparency sets you free always, frankly.
How many of you, A, believe in taxing unhealthy choices?
When you change your lifestyle, it actually changes your genes.
When you have communities where there's no access to fresh fruits and vegetables, where it's not safe to stand out on the porch, let alone walk or jog in the morning, then we have to be aware of that.
The next step is for chefs to become activists and to realize that the only way to fix the system is through people taking action.
Your body is not a noun, it's a verb.
For the first time in living history, life expectancy in our children is expected to drop by as much as 5 years. Our kids.
It will take everyone in the room and then some to really turn the tide, but we can do it. Thank you. Thank you very much. I don't want to ruin what has been a perfectly good day by making you go through a speech. But I can't thank you enough for being here, for participating. I want to say a special word of thanks to our panelists, to the people who organized this, to Jenny Ehrlich and all the people at Health Matters, to the people who've become our hosts, our friends, and now our partners here in the Coachella Valley. We should give them a big hand. They've done a great job helping us. To all the people at the hotel here, thank you very much. I want to say a special word of appreciation to the people who've made commitments here today. Commitments that will improve the lives of 25 million people. I had a fascinating meeting while you were in one of your sessions with a lot of the active people in this area talking about how they were going to partner with us because this is going to be one of our focus areas. And I'll be back in touch, especially with our sponsors, and I thank them. I think we should give a special word of thanks to Tenet and to all of our other sponsors for this meeting. I'm very grateful for them. But they had some fascinating ideas about what they would do. And one of the things I learned when I came out here last year, I'd only been here twice before to play golf. and I had a very limited understanding of the age, ethnic, and income diversity of this area, and why it is really a microcosm of all of our opportunities and challenges in healthcare in America. It's big enough to make a difference and small enough to make a difference for those of us who are involved. So I'm very grateful for that. But to all of you who made commitments, I thank you very much. And to all of you who came with interest, I would encourage you to stay in touch with us and find some way to make your own contributions. Even if it's an hour a month, you can make a difference. And let me just say, I felt last year that we'd done a good job, but I think our panelists were fabulous this year, and I think this was markedly better than last year's conference just because we learned a lot, and the people who participated really did a very, very good job and brought us into focus. I'm grateful for that. But it's difficult to change a culture. It's difficult to change the trajectory of human behavior. All of you know this. And when I was asked to take on this childhood obesity thing after my heart surgery in 2005, it was the first challenge that I had embraced since I left the White House, where I thought, well, it's more likely than not that I'll fail. But I want to get caught trying. I'm a big believer in getting caught trying. There's something to be said for that. But here we are, and certainly our Alliance for a Healthy Generation didn't do it all. It helped a lot that Michelle Obama and the White House got involved in all this. It helped a lot that so many healthcare providers started providing health insurance coverage that gave the obese children of the adults who recovered access to a doctor 4 times a year and a dietitian 4 times a year. There are lots of things that have been done. But the fact that in most places the childhood obesity rate has leveled off, and in some places it's declining in about 7 years, I think ought to give us all real encouragement. And so I hope you will leave here encouraged. I want to thank again, none of us would be here if it weren't for the PGA and Mike McAllister and Humana, and them inviting me to be a part of this Bob Hope tournament and to revitalize it and make it work. And they're agreeing to make healthcare a focus of what the PGA was doing. And I'm amazed, as I said in my opening remarks, how many of these golfers and their families have gotten interested in it. One of our best participants last year, Nota Begay, has been here today, and I'm going to see him tomorrow, and I'm very grateful to him for the work that he's done in his Native American communities, who have some of the highest rates of diabetes in America. So to all of you, just remember this. We've got a job to do here. And there is, the one other thing I wanted to say is in the irrepressible Dean Ornish looked like a kid who just opened his first electric train today, but he's been a friend of mine a long time. He has been trying to say what he said up here on this panel today for more than 30 years, and finally people are taking it seriously. I started trying to get him, as he said, Medicare coverage for lifestyle changes well over a decade ago when I was still in the White House. Sometimes it takes longer than you wish to change course. But if you look at how our society evolved, it's not that there are any demons in all this. What happens is we tend to fix one thing at a time. And then when you layer all the fixes on top of one another, you wind up with a lot of things that are fixed and a lot of things that don't really mesh together. It is the nature of development. And then all of us, me included, we acquire a real interest in the fixes we put in. And we don't want to give them up. And sometimes we have to get a bigger, better fix. So you have cultural factors and organizational factors and all these things involved. But if you just couldn't help, I don't think you could sit through this day to day and see the people say what they say and think about the lives they've lived and the service they're rendering without believing that we can take on this challenge and prevail. This ought to be the healthiest country in the world and the most efficient. And it cannot be that the country that gave the world the internet in Silicon Valley, that was the first country in the world in developing widespread use of cell phones, that electrified a nation, that built railroads across the nation, that took the Industrial Revolution and brought it into play faster than anybody else, that built the world's greatest middle class on the backs of the GI Bill, that we can't figure out how to do this. It is ridiculous that this is a problem that will elude us. This will not elude us if we bring to bear science, technology, ingenuity, behavior change, and we work together doing it. But one of the things Dean said that I want to just close with is there are lots of studies of human behavior which show that talking to people all day long about the negative consequences of what they're doing is not nearly as effective as painting the bright consequences of a change in course. You know, it drives me nuts that we have low voting turnout. But telling people they're bad citizens is not as effective as saying, your friends and neighbors are voting, they're changing the future of the country. Don't you want to be part of that? Don't you want to chart the future of your community? Even holding out the dreary prospect of a life behind bars is not less likely to deter people from criminal action as showing them the joys of learning, of staying in school, the dignity of a job, the connections of people that care about them succeeding. So we've got to make this positive. And I suppose my exhibit A of that is my friend Vin Gupta, who made this commitment after he lost his son to really a freak prescription drug calamity, because there are so many people, even who are really smart, who don't understand you can't mix some of these painkillers with beer or alcohol or wine and go to sleep, because it deadens the part of your brain that tells your body to breathe when you're asleep. So instead of just being angry and wanting to put all these people in jail, what he wants to do is to save all the lives of all the people who, if they knew better, would choose life. If he can do that, the rest of us can too. And I hope you will leave here feeling that way, that you're glad you came, you're glad you're going to be part of a commitment, you're going to come back next year, and 5 years from now, you will look back and be stunned at how far we have come together. Thank you, and God bless you.